Okay, I think we started. I would like to introduce our two speakers today, and first would be Leanna Luca Conley. She is the Deputy Commissioner of Adult, Children, and Family Services. This department includes child protection, adoption, foster care, juvenile and prevention services, adult protection, and the youth bureaus. Leanna is a licensed social worker who has worked for decades with disadvantaged children and families in our county. She will discuss the incidence of poverty in our area, as well as how the county is addressing this issue. Diane Hewitt-Johnson is Chief Executive Officer of Chautauqua Opportunities, a CAP, which is Community Action Program agency established until the Economic Opportunity Act of 1964 to fight America's war on poverty. COI helps people to help themselves in achieving self-sufficiency. She will explain some of the programs COI operates designed to empower people, including a step-by-step approach out of poverty. Now, I do believe that Diane is going to start. Is that correct? Okay, good. All righty. Thank you both for being willing to do this. We appreciate it.
Thank you for having us. We appreciate getting out there and getting the information out there. Can everyone see my screen?
Yes.
Slideshow here. Okay, so Judy had asked me to talk about the impact of poverty on women and children specifically, especially in Chautauqua County. And so as a reminder, poverty isn't just the lack of income. It is also that they have limited access to basic services. They have poor levels of health. They may have a lack of food, shelter, education, some of the basic needs that you and I may take for granted every day. So who is affected by poverty? Everybody could be affected, men, women, children, elderly, all races. And so there's several different types of poverty. And many times you'll hear generational poverty, which is it occurs in families where there's at least 2 generations that have been born into poverty, where situational poverty is caused by a sudden loss or crisis. And it's often temporary, and they have the resources or the skills in order to get out of that situation, where generational poverty, they may not have those skills. There's also urban and rural poverty. It's a little different in each area because of the demographics and of the distance between resources for individuals. People in rural poverty may not have transportation to get the services that they need, where urban they can walk to wherever they need to get their services. And then there's absolute and relative poverty. Absolute is rare in the United States. It involves the scarcity of necessities such as shelter, running water, food. And relative poverty refers to economic status of a family whose income is insufficient to meet society's average standard of living. So just a few facts about poverty. In 2020, there were 37.2 million people in poverty. That's about an increase of 3.3 million more than in 2019. That's a huge jump. Of course, the coronavirus pandemic increased the risk of individuals who were possibly going to fall into poverty. And then also people in poverty may not have access to primary care. And in Chautauqua County, I know that we had a lack of healthcare providers. And then specifically facts about women and children that are living in poverty. In the United States, more women than men live in poverty. And so according to the US Census Bureau, there were about 21.4 million people living in poverty that were women, which is 56% of the population. And of course, if a mother is a single mother, quite often they're forced to quit their jobs so that they can stay home and take care of their children. And then also children are more than likely to live in extreme poverty than adults. The next slide, it's not moving. There we go. This is some specific demographics for Chautauqua County, and I wanted to point out here, the median household income in Chautauqua County is $46,820, which is significantly lower than over here in the United States and New York State in general. In the next two rows, it talks about the population who has health insurance, and so there's been a big push since the Affordable Care Act to get everybody insured, especially in New York State. And so we are actually lower than the United States as far as the people who have health insurance. And then the rent burden, typically they say that you should only spend 30% of your income for rent, where in Chautauqua County, individuals are spending a little more than 30% in comparison to the United States. And then this slide shows that in Chautauqua County, I'm going to highlight all these numbers here. In Chautauqua County, the number of individuals who are living in poverty are 18.2%. Which is much higher than the United States and the New York State number. And so it shows that we have a high number of individuals living in poverty, and especially children under 18. There's 28.5%, where typically there's about 18%. And then down here, female single parents, with children, 48.2% of the population falls into that category, and they're living in poverty, which is extremely high compared to United States and New York State overall. So to pull that all together, because a lot of times people see numbers and it makes their mind jumble. How many people are living in poverty in the United States? Or how many women and children? So in the United States, about 1 in 7 are living in poverty. That's more than 10 million children. Where in Chautauqua County, 18.2% of the population, which means about 22,400 out of our 123,000 who are living in poverty. And of those, 50.7% of women are living in poverty in Chautauqua County. And then the children, there's 7,316 children living in poverty out of 123,000 people. That's a large number. This slide, I just wanted to highlight a couple of things. 31.4% of Chautauqua County children receive food stamps. And the New York State average is only 18.2%. So that shows that there's a high number of children in need of food stamps or other services. And then down here, 55% of children in Chautauqua County schools were eligible to receive free or reduced lunch in the last school year. That is a large number of children, but at least they're getting the nutritious food that they need. So the effects of poverty on women and children, not just it affects their housing, it affects their employment status, their health care, whether or not they have childcare, and then it could also affect their education. And so there's a whole list of things that it could affect, and that's just the tip of the iceberg. So to take a closer look at some of the effects of poverty, last year in 2020, there were 774 homeless individuals and 45% of them were female. And so among the homeless population in the county during 2020, 83.1% were single individuals. So as we're doing our research, we found that in 2020, we served 93 single women who needed emergency shelter. And so there's a program where they can be placed into hotels or motels in Chautauqua County through DSS. Of course, that is just putting a Band-Aid on the situation. It's not cost efficient, and it reinforces transiency and instability in that population. And so one of the ways that we're going to be helping to alleviate that issue is we receive funding through the state to renovate an existing building in Jamestown. We're creating a homeless house for women. It's going to have 12 units with a total of 18 beds. And then they'll also get supportive services and case management that will help them obtain jobs and become stable in their lives. And so we're hoping to get that project done in 2023. And there's clearly a great need for that in Chautauqua County. Income also can affect individuals' health. So statistics have shown that low-income individuals or those in poverty have higher rates of heart disease, diabetes, strokes, and other chronic disorders. So poor health and disabilities can make it harder for someone to succeed in school or to secure and retain a high-paying job. And so, as you can see, everything is interconnected. And I think Leanna may talk about the social determinants of health, which ties into that too. The thing I wanted to highlight on this slide is that health in Chautauqua County, we rank 53 out of 62 counties in New York State for health outcomes, which is pretty poorly. And so there's a high number of current smokers in Chautauqua County. A lot of them are in poor physical health, and so that's why we're getting that ranking. The thing I want to highlight on this about maternity rates, what I circled here are that there's a number of births to females under the age of 19, and it's extremely high compared to overall in New York State. And so that's going to increase the numbers of individuals in poverty. And so when you look at the supply of childcare providers in Western New York, there's 41,957 childcare slots, but the total need is 77,521. And so a shortage of childcare providers in Chautauqua County, this is defined as a childcare desert. And so a childcare desert, if you haven't heard that term, we have been designated as that, and it's a community with limited or no access to quality childcare. And they're typically prevalent in low-income communities, rural communities such as ours, among families of color, and among families with irregular or non-traditional work schedules, because a lot of times the daycare providers only provide care during normal working hours between 8 and 5. There was a recent release by Governor Hochul that announced there was going to be money available to newly licensed, registered, or permitted childcare programs in order to help with that childcare desert. And so the applications are out on the OCFS website so that individuals would be able to start or become registered as a childcare provider. They can do it in their homes, or they can open an outside entity. So some of the available services or resource sources for women and children in Chautauqua County. This is a list. We provide referrals for our customers to many of these so that they can get on Medicaid, Medicare, WIC, which helps women, infants and children, the United Way, the Boys and Girls Club, supplemental Social Security income, Strong Starts, which I know I saw Leanna's background. I had Strong Starts, I believe, in the background. The National School Lunch Program, unemployment insurance, child care assistance program so that they can send them to daycare. And so Chautauqua Opportunities also has specific programs. And so as I was introduced, we have been established since 1965. We're a community action agency, and we look at the needs in the community, and we develop or strengthen the programs that we have to help build individuals up and create self-sufficiency and promote empowerment in their lives. And so we have 5 different service divisions in Chautauqua Opportunities. We have Health and Family Services, Housing and Community Development, Early Care and Education, Child Care Council, and Economic Development. So in our health and family services, they're looking to provide access to health care, health insurance, and health education. And so we have several services that women and children can use, such as the skilled health. We have a licensed home care service where we go out into the homes. We provide personal care to the individuals so they can stay in their homes. We also train individuals so that they can become personal care aides and work in our licensed home care agency. We provide intensive services, which is the mobile crisis outreach program. So if an individual is having a crisis situation, they can call the 800 number or somebody can call it for them. And we have a team of workers who go out after hours to alleviate the crisis and help them develop a safety plan and get them connected to mental health services in the community. Under our family services, we have the migrant and seasonal outreach worker program, where we have an outreach worker going into the migrant farms and having discussions with the migrant workers, men, women, and of course they sometimes have their children with them, and making sure that they're getting the health care that they need and giving them transportation to either health clinics or to doctor appointments. The Responsible Fatherhood Program, although it doesn't sound like it's a program for men and for women and children, in essence it is, because we focus on classes for the fathers, and ultimately we teach them to build their relationships with the mothers of their children and to have relationships with the children also, and do activity with them. And then we have our licensed residential youth services. We have a safe house in Jamestown, and then independent living programs to help youth, whether they're male or female. And we do have youth street outreach program to reach out to the children to let them know about the services that there are available at Chautauqua Opportunities. And then our Housing and Community Development Division, we have several different services. We have our homelessness prevention. We have emergency shelter with the goal of getting them into affordable housing. If they get to the point where they're ready to buy a home, we do the counseling and help them get their loans so that they can purchase homes. We do foreclosure counseling and help stop foreclosures. And then we also have our weatherization housing rehab program and our lead hazard control, which assists with remediating lead in the homes, which houses that have been built before 1975 have a lot of lead paint. And so that's a necessary program. And that is fairly new too. And so this slide, even though there's a lot of words, I wanted to show you that over here in housing and community development, this is the list of number of women and children that are served through housing and community development versus the number of men here. And so clearly there's a much greater need for women and children for all of our housing and community development programs. Then we have our early care and education services, and all of these services are provided to children and women. We have Head Start, Early Head Start, Universal Pre-K for the 3 and 4-year-olds. We have wraparound childcare, which helps individuals who are out in the community working because they need childcare in order to remain employed. While children are in our care, we do child screening and assessments. We do life skills not only for the children, but also for the parents, and we work holistically with the families. And we promote community involvement, and we provide life coaching to those families. And so once again, here's a list that shows that all of the services in this division are focused and geared towards women and children and serving them. And then we have our Child Care Council. And this is the entity that helps providers, childcare providers or families get connected to childcare. And so with the providers, we provide training to them. We'll do classroom assessments, coaching, mentoring. We have the CACFP program, which is the Child and Adult Care Food Program, which reimburses the provider for serving nutritious snacks and meals while children are in their care. assists not only them, but the children that are coming to stay with them during the day. And then we also help families get connected to childcare that's available. And we have had childcare up at the county family court. So if individuals had to go to court, they could leave their children with us and not have to witness what's going on in the family court. Since the courts have been closed, we haven't been able to provide that during the pandemic, but we intend to get that started as soon as possible. And so this is just more information on the Child Care Council. And so most providers are women. And so we do encourage individuals, whether they become licensed or legally exempt, to, start a child care provider business in their home. We also have the Child Development Associate credential that we do the training. And so then they can become, they could work in our Head Start, early Head Start, and work directly with children, and it also gives them a job. So it gives them a step up. The Child Care Council also provides the summer food service program for children. And so during the summer months, we provide free meals to children aged 18. And there's various sites that we will drop that food off. And we have partnerships throughout the community to make sure that the children are continuing to eat throughout the summer. Because quite often when children go to school, the only nutritious meal that they eat during the day is the meal that we give them at school. And then finally, economic development, which is also known as CODI, or Chautauqua Opportunities for Development. This was created as a separate agency, and it was originally created to assist entrepreneurs, whether they're a business startup or expansion or a cottage industry in their home, where we would provide technical assistance, training, and loans to help them get started in a business. And build up their income. We also expanded that out where we do consumer loans for home appliances. So that's called the Home Appliance Loan Program. And that is to help with the predatory lenders that quite often take advantage of those in poverty. And so they get a reasonable interest rate and they're able to get home appliances and get them paid off within a reasonable amount of time instead of paying twice as much as what they're worth. And so this is a summary of all of the divisions that we have with the programs that we have specifically that help women and children. And as I said earlier, we do focus on looking at the needs in the community and developing or strengthening the programs that we have in order to continue to serve our community. And so that is all I had. Were there any questions?
You can put a question in the chat, or if you see down on the bottom of your screen is reactions, and if you put your hand up, you will be the first on the screen for me to see that you have a question. So Marsh, okay. I'm going to go with Marcia first. Marcia Johnson. You're muted, Marcia.
Okay, thanks for the presentation. It's very impressive. I had no idea you did all this. What I was wondering, you were talking about trying to train childcare providers. What are you doing to try and find people who would be interested into doing this type of work? How do you get these people?
Well, we go to all the job fairs that are available. We do offer open interview days. We post it on our website. We post it on Facebook. We advertise in all of the typical venues. We advertise on LinkedIn. And so we have also have connections with community colleges. And so we are open to finding individuals wherever we can find them. And quite often we'll have teacher assistants apply. They'll start working in our Head Start, early Head Start programs. And then within a year, they can start going through the training while they're working. And once they complete their CDA, then they would be able to get an increase in pay once they obtain that.
Is there money available for people who want to run daycare centers out of their homes to get, the necessary supplies and everything in order to do that?
Well, Governor Hochul just released that funding.
Oh,
And
okay.
so they can go on the Office of Children and Family Services website and directly apply. So if they're interested in opening a new one, yes, right now there is money available.
Thank you.
Okay, Judy, did you have a question?
Yeah, I had a couple, but I wanted, one is a clarification. I don't know if I read this correctly. The pregnancies from 10 to 14.
Correct. You did read that.
I'm appalled at that. And because it tells me many things. One is, what are we doing with birth control and sex education? That's just because if they're under 14, a lot of that, I'm even questioning how much of it is sexual abuse. How many, what are the men? Are they over the age of 18, or whatever. But anyway, that's a very, and I want to know, what is our county doing to address that? That's just shocking to me. What was that percentage, Diane?
I'm looking it up right now. 10 to 14 is 0.28 in comparison to New York State, which is 0.13. So it's almost double of what New York State is.
Mhm.
And so I don't have an answer as far as what services or what the focus is. I do know that we were just informed yesterday or the day before about a new grant that's coming out that's targeted to assist with this. And I did contact Chris Schuyler, and she said the county is going to be applying for this grant. And so she's just in the beginning stages of pulling information together and pulling groups together as a collaborative, because it would be the county and WIC and several other agencies working on it.
And my second question is on the crisis services.
Mhm.
I wanted to know how that you're connected with the police. Like when the police, like I'm just thinking in Fredonia that I kind of wish that they'd called crisis in for that kid that was using LSD and he got killed. But I'm thinking, do you have a good connection with the police? I mean, like the whole concept of not funding the police really is not funding the police. It's adding to the police by crisis things. So are you called by the police on a regular basis?
We are called quite often to go out to situations, or they're already at a situation and they need our assistance for a 945 pickup order, which will take an individual to the hospital if it can't be de-escalated. And I do know that in collaboration with the county, the sheriff had applied for some funding and they've received training, CIT training. They've also received some iPads that were trying to figure out how we're going to fit into that program, as far as the police will have some iPads, we'll have iPads, we'll have direct connection to a doctor if needed. And so we have a good relationship with the different police stations throughout the county, and they have no problem calling us if they need our assistance, and we have no problem calling them either.
Okay, I think I'm going to move on. Gail, I'll get you in a second, to Joy Bilhart's question. Is there any measurable effect of the Amish population on average income in the county?
Oh, I wish I could make Judy Yonkers unmuted because she does a lot of our demographic data. Oh, she unmuted herself.
I would say probably not, because I don't think they respond to the census. So these are all census numbers. So if they're not responding, then I wouldn't think that their incomes would be included in that data. So.
Okay, Gail, thank you for that answer. Gail.
Great news about the proposed homeless shelter for women. That's great news for COI. I wonder if there's been any discussion if some of those slots are open at a particular point in time, if they would be open to victims of domestic violence.
They will be open to any woman that needs shelter. Originally, we were applying for women and children, but we couldn't do a combination of the two. And so if there is a need, then they would be able to come stay with us, correct?
Thank you.
Okay, if there aren't any further questions, we can hold them off until the end. And I've introduced Leanna, and she can now take it away. If everybody would mute themselves, please.
Okay, let me share my screen. Probably some of this is repetitive of Diane, but Diane did a really great job of introducing poverty to Chautauqua County. And I will probably just do an overlay of what Diane had talked about. Can everybody see this?
No.
No, okay, hold on.
Oh,
What did I do? 1 second. Where is the share screen? Okay, we'll try this again. Can you see this now?
Great.
Yes.
Okay, let me try to. Sometimes technology is hard to get used to. So on my front cover, I put our 2021 annual report. And we actually, if you go to our link, which is shown above, you could gain access to that report, and it will break down pretty much our demographics of caseload sizes in health and human services, from public assistance and Medicaid and child welfare, foster care, so you name it. It will highlight those areas, which is kind of a nice segue into, really kind of learning about what we're seeing here in Chautauqua County. I just wanted to add, because I know Diane talked a little bit about COVID, and I can tell you COVID really changed our world for better and for worse. It was like two worlds. I think for better, because as a county, we became more efficient with technology and better able to engage individuals, where we got waivers to allow people to apply, via phone or online, because we know that sometimes, looking at the trauma-informed lens, a lot of times people do not want to come into a government office building and apply for public assistance or to get help. So in a way that's applied flexibility. On the other side, with COVID, during that time, a lot of agencies shut down, and which caused a lot of people to go backwards. Especially we saw it with child welfare. We didn't have the mandated reporters out there that we needed with the school systems. In fact, we still have kids 2 years in that haven't even returned to school. So with COVID, it's really caused a little bit of a chaotic world right now, trying to re-engage people and give them that structure. Because we know that families struggle, and a lot of families were, whether it was domestic violence with the isolation that was occurring during COVID, or the substance use and mental health type of situations, was causing a lot of discord in their homes, and people ended up going backwards. So it kind of gave us an appreciation for those agencies out there that remained open during that time to try to engage families. This is just, which this is actually on our report, but letting you know what our mission is, our values and principles, because we are the Health and Human Services Department. What's unique about our department is we work interconnectedly, between all the divisions, because a lot of times what's happening in the child welfare division that I oversee, those individuals are also connected to public assistance or Medicaid, or adult protection, or there could be an environmental services type of situation because of the housing conditions. So there's a lot of interplay when it comes to our department, which is nice because we all work, you know, connecting those pieces together. I believe Diane shared this, but you know, this is the 2022 poverty guidelines. You know, knowing, you know, for 2 people, poverty guidelines is 18,310. I can tell you that people cannot afford to live in Chautauqua County right now. I mean, that's part of our housing situation. Is our housing stock is terrible, but rent has increased immensely. So to even find a decent apartment to be able to afford right now is terrible. And I know that some of the initiatives like with COI, UCAN, and also Salvation Army. In fact, we just had a meeting yesterday with the YWCA regarding their transitional housing program and talked about how, you know, people are tending to stay longer in programs like that because they can't afford the rent or can find something that they can afford, you know, in Jamestown or Dunkirk. So that's something that, you know, really needs advocacy around. I know that we have some great things coming in 2023. Sometimes you never think it's going to happen. But, you know, the housing situation is one of those things when you think about social determinants of health, or even Maslow's hierarchy of needs, you know, without safe housing, stable housing, you know, food, in the basic needs like water and electricity, you know, people they're not going to focus on some of the other challenges such as getting a job, you know, substance use, mental health. So, you know, the housing situation is by far something that really needs to be worked on here in Chautauqua County. And not only that, safe housing when it comes to lead, which there's a lot of initiatives right now working with the city of Jamestown with lead. Child poverty, you know, Chautauqua County has the 4th highest child poverty rate in New York State. And of course, you know, out of that, 29% of children in Chautauqua County live below the poverty line, you know, as comparable to New York State's overall 20%. You know, we're kind of like one of those counties that you get a lot of attention on. I think a lot of people in New York State don't even know where Chautauqua County is because we're the furthest away, right on the Pennsylvania border. But some of our demographics are really harsh, especially when it comes to what Diane shared with our health demographics, you know, compared to the rest of the counties in the state. 21% of the children in Chautauqua County are children of color and a disproportionately poor. So it breaks it down, you know, looking at the Black and Hispanic and white and Asian population. And Black and Hispanic children in Chautauqua County are over 2% more likely to be poor than white children. And there again, looking at, you know, access to services, that equality type of situation, you know, really looking at how our system is approaching diversity and what that looks like. Female poverty rates, I didn't go into deep detail because I knew Diane would be a really good source of data. But there again, you know, the 18.2% was Chautauqua County for poverty rate. And then breaking it down by age when it comes to females in poverty. And really the age range 25 to 34 is the highest, which I would say would constitute, you know, women with children, single women, you know, struggling with trying to make their needs met. I am certified in Bridges Out of Poverty, so a lot of times I throw these slides in as well. But I know Diane already looked at this and addressed it, but generational poverty and situational poverty are different. When you're looking at generational poverty, you're looking at individuals that from family lines that have been part of poverty, you know, 2 times or more. So it's harder to get out of that environment because you don't have the resources to get out of that environment. Where situational could be divorce, a loss of a job, but you have the resources to actually climb out of poverty. Those connections, you know the hidden rules to kind of navigate, the area of middle class. An individual always brings with him and her hidden rules of the class in which he or she was born. So, really looking at what it looks like when somebody is in poverty. A lot of times poverty, individuals are very glued to the relationships. Relationships are important to them. I always use this as an example because it's actually a while ago, I did the Bridges Out of Bridge College to Work program at Jamestown Community College. And I had an individual that was of generational poverty. She ended up getting a really good job at social services. And I get a call stating that she didn't show up one day. So I end up calling this individual and I say to her, what's going on? Why didn't you show up? This is only your third day of work. And she says, well, I had to help my neighbor move. And I said, well, you just started a job. You don't want to lose that job. This doesn't look good. And she goes, Leanna, if I don't help my neighbor move, who's going to help me when I have to move? So that was kind of an aha moment for me to realize that correct, because you only have so many connections. Who's going to help her move if she has that situation? And then, being able to hold on to those relationships, which impacts, also being able to work and doing other things. But that was a really important lesson for me. A couple others is, people not having those relationships, in the community to help them in the moment, such as being locked out of their apartment. I had a situation where, a girl moved to our area from a DV situation, and she had 2 little kids. She worked all night at Lutheran as a CNA, went back to the apartment. The landlord's from out of town. She doesn't know any of her neighbors, nor does she want to, just because of the neighborhood, and wasn't able to get into her apartment. So she came to me, as a caseworker, trying to get into her apartment because she didn't know anybody else, and walked around the streets of Jamestown until, our office building opened the next day. So it makes you realize that we take things for granted, having those friends and family around us that can help us through those moments. And then also realizing that schools and businesses do operate from middle class norms. So, a lot of times, we value being on time. We value certain things that, being able to come to work and not have multiple calls coming in from family and friends, and, really understanding sometimes during, a transition to a new job or something that's happening is really helping and supporting and having those wraparound supports for somebody that's just starting. Because it's hard to climb out of poverty. I mean, once you're poor, it takes a lot to get out of that, because all of your connections are also in poverty, and you still owe for bills. I always talk about how our system keeps people in poverty based on, we're a crisis-oriented system. So if somebody needs help, they have to wait for a shut-off notice. So we teach people to always be in crisis, which to me is really backwards. So, when you get into those dynamics where people are waiting for that eviction notice and they're waiting for a shut-off in order to get help, what does that say? So there's a lot of things that could change in the system. That's one of them. And then in order to move from poverty to middle class, or from middle class to wealth, an individual must give up the relationships. And that's a little bit about what I've been talking about. Being able to connect with other people when it comes to, understanding those middle class hidden rules, also making connections with going on to education. A lot of the kids that we work with, their parents never went to college. They weren't brought up with, something instilled in them that they were going to go to college. Even these kids struggle in school high school, even showing up to high school is one thing. But when you talk about college or an apprenticeship type of program or trying to get a skill, a lot of these kids are like, yeah, no thanks, not doing it. Because most of them aren't even going to school to begin with. I really like this because it kind of breaks it down. And I know Diane talked a little bit about it, but a lot of times when people think about poverty, they're only thinking about financial. And really, when you look at poverty, it has a lot, it's the emotional. So being able to choose and control, emotional responses in negative situations without engaging in self-destructive behaviors. A lot of times people don't have those emotional resources. And when they're in a school meeting or when they're in an interview, they may say and do things that doesn't best reflect on them. Mental, having the mental abilities and acquired skills. So being able to read, write, comprehend. I always, get a little bit annoyed from all these state forms that come out, especially through court. Some of the court forms that some of our families get are not 8th grade reading level. I have to read them a couple times because I don't understand what the heck I'm reading, because every other word is a legal word. So, really looking at, our forms and our applications and, is it something that people can really understand what they're reading? Spiritual, believing in divine purpose and guidance, that sense of hope. Physical, having physical health and mobility. I think that's one of our biggest struggles here in the county right now. We have a lot of people with disabilities. That impacts housing. I mean, that's a needed area of a housing units that individuals with disabilities can go to, because a lot of times what we're doing is we're going around to different hotels trying to find a handicapped accessible room, which really isn't a safe and adequate situation for an individual. Support systems, which we talked about, but, really having those resources around you, that family and friends as backups, those people that you can count on if you can't get to work one day or your child care provider is sick. Relationships and role models, having frequent access to adults that don't engage in destructive behavior, but also can be that role model on, what you need to do to go to college, what you need to do to get a job, making those connections for them, and the knowledge of the hidden rules. But I think it's important to realize that poverty is just not about financial. And then challenges, I mean, we know where the challenges are. At childcare, we have a lot of money being poured in from the state for childcare, but I think part of the struggle still is, you have that in-between family situation where they're not meeting certain guidelines for childcare. They're in the in-between because they make just enough, but it's not enough to, pay for ongoing childcare. So I think there still is a lot of policies that can change around childcare. I know years ago, and I don't know, Diane, you might have been there, we had Tom Reed come in and talk about some of the things that could happen when it comes to public assistance, in the challenges. And we really talked about, giving families that year, once, they get a job, having a year before their benefits are cut off to give them a way of climbing out of that hole of poverty, because once you're cut off, there's a lot of things that they don't have access to anymore. And you're still trying to dig yourself out of that hole, which I think would be useful. But substance abuse, I mean, that's one area here in Chautauqua County that we're struggling with. As far as even the babies that are being born exposed, but, COVID has caused us to really go backwards, with that situation, along with mental health. And then this is just one of their little quizzes, but, could you survive in poverty? Which is always interesting because, looking at this, I always like the one, I know how to get someone out of jail. Some people know that very well, other people don't. I know how to physically fight and defend myself physically. I know how to get a gun, even if I have a police record. I know what problems to look for in a used car. I know how to live without a checking account, but some of these things that there again, we take for granted. And, a lot of people living in poverty are very resourceful. I always say that about the kids I work with. I mean, these kids are so resourceful because we have a lot of kids that pretty much are raising themselves right now. When we talked about the teen pregnancy rates, I mean, we're one of the areas that is being most effective with sex trafficking right now. And it really has to center around our poverty and drug use, not to mention some of the labor trafficking that's happening in our area as well. And then this is something that, I just love this, no significant learning occurs without a significant relationship because, I just believe that, if you can't engage with somebody and have that really good relationship with them, it's hard to move them out of that poverty. It's, having somebody that you can trust and form that foundation with. But that's it for my slideshow. Let me stop share. Any direct questions?
I do.
And you could put it in the chat or, raise your hand. And I see Marcia has Marcia Johnson. If you have another question, that'd be great.
I do. I went to the report that you mentioned. And on it, it said, well, as of December 31st of 2021, there were 1,400 people in our county receiving cash assistance. I just want to say, I think people are under the impression there are tens of thousands of people living off of welfare, as they call it. And I guess this is just a comment more than a question. I think people need to be aware that it's not, as this is a dire situation, but I think just the fact that so many people think it's so much higher. I was surprised at how low that figure was.
Well, there's a lot of things that contribute to that number, because remember, there's a 5-year time limit for cash assistance, which what happens is once you reach your 5-year time limit, you fall off those rolls. So that doesn't mean that those people have a great job and they're living like kings and queens. So that's one of the situations that do affect those numbers. I mean, we have, I believe, a high population that are on Social Security and disability because of the situation. So that's another area. But we do, and then we have a lot of the working poor, right? I say middle class, but I think middle class is getting squeezed into their own category now because we have a lot of families struggling, especially with what happened with COVID. But you have a lot of families that they're working just enough not to meet eligibility for cash assistance, but they're still able to get food stamps or Medicaid.
Okay, Judy.
We're always looking, Leanna and Diane, for things for the league to promote. And one of the things is I picked up from you is, would it be to maintain whatever assistance that they were getting for 1 year after they're no longer qualified? Like when they get a job and all of a sudden your income is over, so you don't, is that what you're suggesting, if there was a 1 year period?
Well, I'm suggesting that it's a way of climbing out of that hole. you know,
Uh,
because you're, you know, after 90 days after receiving a job, it's kind of like you're cut off of all those supports. And remember, you have a lot of people that, you know, they were dependent on our system, you know, like, you know, cash assistance was paying for their rent and their utilities. And, you know, so there's a lot of, you know, I guess, culture and learning those type of skill sets, because once you're cut off, you know, and I think that's where people struggle, where they think it's just easier to be on the system than it is working sometimes, you know, and we know that's not true. But I think it's just a struggle to kind of like change your thought thinking, and also having those resources available. And I'm not talking about, you know, because we have tons of programs, we have case managers, we have care coordinators. I'm talking about relationships, you know, and that's really, you know, like I love some of the faith-based approaches that people are doing, but, you know, having those friends and, you know, connections out there that people can count on, because once, you know, and you're thinking, I mean, a lot of people that are in that poverty area, they're single adults with kids, you know.
Isn't that the program that Jane Becker is trying to initiate, the woman that where you would become a mentor?
Well, there's a lot of, yeah, there's a lot of
Yeah.
peer-to-peer programs, woman to woman, I believe it's called, peer mentoring. But, you know, we have the peer, you know, Mental Health Association have peers that are lived recovery, which, you know, they're great. You know, and that's a way of building that trust and relationship, because I think a lot of times people just have a lack of trust with our system. I mean, with the county system. You know, and I guess, you know, because I was on, you know, I was a single mom, you know, I had a child in high school, and I can tell you, you know, I'm thankful that I had the resources. I had, you know, parents that if something was happening, I could go to them. But it's not an easy situation when you're on public assistance and then trying to climb out of that hole. So my thing is just trying to have extended time period, you know, to give people kind of an empowerment, you know, or have I know COI does a lot of these programs, but being able to save money, you know, because
There would be maybe something that they could do would be to support a bill that would say, you know what I mean? I don't know if there's any bills that have been sponsored like that, but maybe we could ask someone to sponsor, because that does make sense to me. As a single parent, when I was a single parent, if I had a decision between working and having healthcare for my kids, I would have chose the healthcare in a heartbeat. And any responsible parent will make those, you know, decisions, you know. And so I'm thinking that the 1 year off, I don't know, what do you think, Diane, too? I mean, would that be something? Because the league is always looking, what can we do to help? And we're usually more legislative. And would that, if there was a change in that, would that be effective, do you think?
That would be effective, but one of the things I did not mention is that the Community Services Block Grant is up for reauthorization. It has not been reauthorized in many, many years. And so David Bradley, who was instrumental in creating that way back in the 60s, he's still in, you know, first and forefront in that. And so he already has brought that to Congress. They're looking for support. I can get the bill number if you would like. I know that
Please.
We also had sent out emails to our partners so that you can provide support by writing the letters of support. And so we had hearings back in November and December. And so they're looking to reauthorize it for 10 years, and they're looking at making sure that all community action agencies who provide services under that focus on the outcomes that we're producing, not just giving out handouts. And then one of the big things is that they're looking to change the eligibility from 100% of poverty rate up to 200% of poverty. And so during COVID, they did a temporary extension of that and allowed us to spend funding based on 200% of the poverty level of income. So that would help individuals who, if they did get a job, they'd still qualify for some of the services, and then they'd be able to strengthen their lives.
To follow up on Judy, I put my email. If you have legislation that would be, something that you would like us to support, I can, put that in our leaguer or, emails. And so people can make a decision, about that legislation. We'd be more than happy to address those legislations you feel that is important. Any other questions? Okay, Joy has universal health care would help alleviate the necessity of choosing between health care and welfare.
Oh, we know that.
The hats off to that too, Joy. Thank you.
He has a question. Robert.
Roger? Okay. You're muted, Roger.
There we go. Yes, we have the RO Foundation that provides transportation for people that can't afford to go to Roswell to see a relative and so forth. Actually run by my next door neighbor, Maggie Owen. And she does great work with that foundation. My question is there an analogous situation where in order to help people get off of welfare, I mean, a lot of people I think would want to get off of welfare and get a job, but they have no way to get to work and get home. Is there any program in Chautauqua County is like a carts? We have carts where we take elderly people all over town and to doctor's appointments and so forth. Is there any analogous situation for somebody that wants to get off of welfare and have a job, but has no way to get to the job?
Well, I mean, back in the day, Crick used to have an earn a car program, and we used to have something called SOS, which was really, it was retired seniors that would, assist with providing transportation, but that became a liability situation.
How? Why? How to become a liability?
Transporting somebody in somebody's car, and if there's an accident, yeah.
The age of litigation.
Yeah, so that kind of fizzled, but I utilized that program a lot back then for individuals, and it was great because what was happening was the drivers formed a really good relationship with the individuals that needed a ride to work, so it was a win-win on both sides.
What happened to the BOCES program?
I'm not sure.
There was a woman from DSA, Irene Rudner, and she actually went to Washington, D.C. and had a and it was a fabulous program. The kids at BOCES, you would donate an old car, they would fix it up, and then it would be given, Roger, to someone who got a job that didn't. It was perfect for rural county. I don't know why.
Have you seen the things on television where like this one kid was walking 16 miles each way to a McDonald's? And a cop kept seeing the kid. So he picked the kid up and said, what's up? And he told them, and the police all got together and bought him a car. And another case where a similar situation where they got together and got the kid a bicycle. But there are people out there that have to walk miles to get to work. I've picked up hitchhikers who, against my wife's wishes, but I can have a concealed carry permit too, so don't worry about me. But I worked after high school Monday through Friday, and I hitchhike Central Avenue from in front of Manzeni up to the, people don't know about the EMP, but we used to be the biggest around. But my point is that pick up hitchhikers, and I've had the last guy, he was walking 3 miles to work and back.
Well, that's something where I talk about having that time period to be able to not be cut off right away when you get a job, because that would provide, the resources you need as far as, I mean, we don't have a lot of Uber drivers around here, but to be able to take a cab or to be able to get to a situation where you get in, get a car. I mean, I know there's some programs through workforce development that helps there again with trying to save money towards stuff like that. But, that's where you're changing a whole mindset and culture, because this is environmental too. We've promoted crisis-oriented lives. So everybody's living by the moment. And once you get money, if you've always been poor and you get money, you're not necessarily thinking about saving it. You're spending it because you've been in poverty for a long time. So it's a whole shift in your thinking patterns when it comes to getting out of poverty. But that's where
the answer to the question is no, apparently. There is no CARTS, no RO Foundation. There's nobody who can give somebody who wants to get off welfare a ride to and from work.
No, I mean, we have carts. We do have carts, but remember, people also have to drop their kids off at childcare. They have to show up to work on time.
Right.
And it's only on the carts routes. So you still may be in a situation where you're still going to have to walk because the route isn't near your childcare and it's not near where you have to like go to work.
But there used to be retired people that picked up people and took them to and from work, you're saying? And that fell through because of
liability.
Yeah, that was
legal problems.
Reinstate the program at BOCES. That's a win-win. I mean, it's a win for the kids learning how to redo a car, and it's a win for the person that needs a car. I don't know. I don't know whose responsibility it would be to look into that. Roger, you can look into that. It was a big program, and you would just donate a car. Does anyone else remember? I'm so old that I know Gail remembers that.
Yeah, it was called Earn a Car.
Yeah, and I remember who started it.
Yeah, it was between BOCES and Crick.
And DSS, because she worked at DSS, Irene. But I'm just wondering how to bring that back, because that just seemed to me like a good program, because just to say, Roger, just what Leanna said, it's not just getting to work, but on your way, like me, on my work, I would drop the kids off, maybe stop at the grocery store. If you're a single parent, you have a lot of things to do.
But, well, sorry, it's telemarketer. Yes, well, it's in Frederick, Maryland, where I was, this woman started a shuttle to and from the 3 major airports around there, and she would hire retired people to do that. And so I thought, I would be willing to do that. But if indeed, we live in a litigious age where it takes one bad apple to file a lawsuit. And apparently, that's from what I'm hearing, there used to be such a program, but it ended because of that.
I have a question. I used to work in maternity at Brooks, and obviously everybody knows there is no maternity unit, and we have really not a lot of OBGYN. And I don't see us really ever getting another maternity unit. Is that, what has your experience been in terms of that affecting mothers or pregnant women here in the county, or in our part of the county? Has it had a huge impact? I just was curious.
Well, I know one of the reasons that Brooks, which I know they're still talking about possibly reopening it, but one of the reasons they closed it was because of the numbers. There's a lot of people that go into Pennsylvania with those hospitals along with WCA or UPMC. I haven't seen any impact. I mean, when it comes to poverty, it's trying to engage people into prenatal health. There's a lot of women, many women that actually show up to the emergency room to deliver. And, you know, that's really where our Strong Starts system kind of comes in, you know, to make sure that we're able to get these women help and also track these babies, you know, up to the age of 5 with developmental milestones.
So is there a significant number of people delivering in the ER at Brooks?
Well, they'll go up. I mean, not, they would probably be transferred to somebody else.
Well,
But I'm talking about that show up at UPMC in the emergency room, they would transfer them up to, you know, maternity. I would say probably the same thing with Brooks. They would transfer them to, you know, a maternity area if somebody showed up there in labor.
I was just wondering if you knew the numbers. I'm just curious.
Yeah, Brooks, the biggest impact that we've had with Brooks is when they closed their behavioral health unit. That's been, you know, an impact, you know, just because UPMC gets inundated, and then also Erie County, which, you know, then you're talking distance for families.
Mhm.
I have a question about the birth control. Who is doing birth control in our county, and where can you go get it, and how easy? I found that it used to be very easy when the county ran it. And now that the federal healthcare centers, I find it very awkward and not friendly to the teenagers at all. And I mean, I go there a lot with my granddaughter. But I was just wondering your thoughts on that, because we're talking about significant teenage pregnancy.
I know that the federally qualified health center, they're the ones that took over family planning for the county, because they can offer a lot more than what the county can. I mean, obviously, when there was a pandemic, all of our resources went to COVID, which isn't good for the population either, because everything else stops and then we focus on COVID. We also have the YWCA that's doing the pregnancy prevention planning. I always forget the names of some of these programs, but they're in the schools. That was kind of there again during COVID. Nobody was allowed in the schools. The schools shut down. So I know that's getting back up and running again, where they go in and they provide that education to kids.
Not just the education, the actual things.
Oh, no, they talk about it, show them how to use it, and we'll provide some of the stuff. I mean, and then the other stuff they'll link to, you know, the FQHC if it's not like a condom or foam or the things that you take out.
What I have found that at the federal healthcare center, at least the one in Dunkirk, and I really like them, and I like the people that are running them, it was not friendly to birth control for teenagers at all. I mean, yes, and it is better quality that they go in there and they get testing and things like that. But I'll tell you what, I liked it much better at the county. You could go in and just get that's all the kid wants is, and I know that that's probably not medically, but they used to do it at the county. When I first took my granddaughter, that's all we had to do, and she got it immediately. But then when we had to go to that federal one, you're waiting around for an hour for your appointment, and it's just, and that's very concerning. And that might be something that the county might want to discuss with them of how to make it easier. Do you have contact with, I know Becky runs the one up here, and the main guy that runs both of them, I forget what his name is, but maybe to talk to him about making that portion of it easier.
I mean, I know there's many discussions with Mike Pease about the federal. I mean, one of the things that a lot of agencies are struggled with, including the FQHC, is staffing. So that could be part of the issue. The other issue is they've been in constant transition, because now in Dunkirk, I mean, which isn't, that clinic is very small, but they are building that new clinic where they're transitioning everything over there, which could help. But, yeah, it's kind of growing pains with an organization because, they get a lot of money from the federal government. They can do a lot of things there, but I think on the other side is trying to get the staffing in place, which I know COI has been struggling. I've been struggling. I mean, nobody wants to work for government anymore. You're like begging people to come in and take a civil service test. So, just trying to look at, we can talk to Mike about that to see how they're, addressing some of the teens. And I know some of our teen programs, making sure that they're more out there as well. Because some people are really good with working with adolescents and others aren't. That's also, that's also something to think about. I mean, we've had some really good people over the years, like at the YWCA. Taylor Winters was great when it came to talking to teens. In fact, there was some moms that invited her over during slumber parties to talk about, sexual, contraceptives, because she just was she could talk about that, where sometimes when you're an adult, it's hard for us to, talk to the adolescents about sex. So it's making sure that, those staff are comfortable too, with that age group, because it's important.
Okay, are there any other questions? And we'll kind of wrap up right now. 2 excellent, outstanding presentations. Thank you so much. We all appreciate your knowledge and expertise and background. Thank you so much. So unless we have any other questions, I appreciate everybody joining us on this Zoom, and obviously appreciate very much Leanna and Diane coming to join us. So
Thank you.
Thank you so much.
Thank you for inviting us and getting the information out there.
Thank you.
right, I think we'll be ending the program then.
Thank
Thank
you,
you.
Mary.
Bye, everybody. Thank you.
Bye. Thank you, Mary and Judy. Bye.
Good job, Mary.
Thank you. Bye-bye.